One of my patients came to me that he engages in Mondays and Thursday fasting, and he observed that there are a lot of benefits because his blood sugar is now good, and he asked me if he can continue doing that kind of fasting. And I told him absolutely. A diabetic patient can engage in fasting because it has a lot of benefits. A diabetic patient should be allowed to fast. Just because you're diabetic doesn't mean that is an excuse enough not to fast. But before you engage in any kind of fasting, it's important that you discuss with your doctor, because maybe one or two advice that he will give you to ensure that your fasting will not cause you any problems. But it's very important for you to know that there are certain conditions that will stop you from engaging in fasting. One, if you have severe ulcer, people that have severe ulcer engage in fasting, they may come up with a lot of complications. Or you have severe kidney disease. If you engage in fasting, you may develop low sugar level or hypoglycemia. Similarly, people that have severe liver disease, they also have problems when they fast. So please discuss with your doctor to see your risks if it is good for you to engage in fasting. But what are the benefits of fasting? First of all, it lowers your blood sugar. Fasting has been observed to increase insulin sensitivity. So if your insulin is functioning properly, of course your sugar level will be good. Apart from that, it lowers your cholesterol. You know, diabetic patients have challenge with cholesterol level. Engage in fasting, it will lower the bad cholesterol, reduce your risk for heart attack and stroke. It also reduces weight, especially people that are overweight or obese. If you engage in fasting, it will help you in your weight loss journey. It is very important for healing and repair. So fasting is also very important to mop up all the dead tissue in your body. So, but how do you go about your fasting? First of all, it is very important that diabetic patient take the pre-dawn meal, or make sure you do your suhoor. Make sure you eat adequately but properly, and also take enough water. And it's important before you start the fasting, check your blood sugar level. So during breaking of the fast, make sure you take something watery to rehydrate yourself, and later you can eat food. And it's very important for you to note that there are certain situations that you must break the fast. If your sugar is low, less than 3.9, if your sugar is high, greater than 16.7, you need to break that fast, or you are severely dehydrated or severely ill. So fasting is very good for a diabetic patient if it is done properly under the guidance of your doctor.